What can you do? I mean, if you have the view that a lot of the public systems we deal with are sort of fundamentally ill-designed, there's a different way it could be. What do you do next to try to deal with these hospitals or to deal with transport systems?
Well, I think the way that we've found most often we get the opportunity to do is to find some piece of it that seems relatively instrumental in everything else. So, for instance, several years ago we started to look at how could we improve some of the key parts of the hospital experience. So emergency rooms, for instance. The emergency room massively affects, if you go through the healthcare system with a healthcare emergency, the experience in the emergency room itself massively affects your overall experience. Right. If you go in there and they don't know who you are and they don't know how to deal with you and they leave you left in a hallway on a gurney for a couple of hours, I mean, all that completely affects the rest. So that was a place where you can go, it's still complicated, but you can go in and do something better. A project that we've just finished doing that is also in healthcare, but is more connected to some of the conversations that have been going on the last couple of days around the new Healthcare Act, is that we've just finished developing the prototype user experience for the new healthcare exchanges. So here's something that is going to affect a lot of people's experience of healthcare. It's how they're going to make the choice of which healthcare program that they're going to pay for. That's a very difficult and complicated process. Today, where it's done with paper, and there are hundreds of choices, massively inefficient. Under the new healthcare laws, kind of a lot of people are going to be having to make these choices, and every state is going to have to manage.
Or they're going to get to make these choices, as the Supreme Court has now told us.
Right. Now they're going to get to make them. Yeah. And so we worked with the California Healthcare Foundation and a number of states to create the sort of prototype user experience. What are the key pieces and parts of that? How are we going to give people reasonably simple choices so that they can make intelligent selections? Put that together as a prototype, and then each state will then get to kind of develop its own individual version on top of that. So it's like giving them a platform to use. So that, again, it was an example of, it's not the whole healthcare system, but it's something that's going to be relatively instrumental in people's experience.